Missouri Democrats are demanding Republicans schedule a special session in Jefferson City to respond to the overturning of Roe v. Wade.
Some hospital groups fear their doctors could face criminal charges when they perform procedures on pregnant women experiencing complications. Our political editor, Mark Maxwell, has the latest on the national abortion debate. Mark.
Ann and Mike, politicians and doctors are still coming to grips with what post-Roe America looks like in each corner of the country. While Republicans in the Senate defend returning that debate to each state, Democrats accuse Republicans here in Missouri of delaying that debate from taking place while women need urgent medical care.
Near the Missouri border,
our Illinois clinic has seen appointments triple.
And across the entire state of Illinois,
the number of out-of-state patients has doubled since Roe v. Wade was overturned.
Demand for abortion care is rising in places where it remains legal. In states where abortion is banned,
women's health and in some cases their lives are at risk.
Democratic lawmakers in the U.S. Senate and in Jefferson City are sounding an alarm.
Doctors are hesitating. They need clarity.
House Democrat Peter Meredith says hospital executives and attorneys have serious questions about when their doctors can begin a procedure.
Whether the health of the mother exception, when that comes into play.
Putting doctors in impossible situations.
Dr. Colleen McNicholas is the chief medical officer at Planned Parenthood in St. Louis.
OBGYNs who are sitting on patients in emergency rooms while they bleed, while their vital signs become unstable, while they're waiting for hospital lawyers to decide, is this patient sick enough?
Under a strict interpretation of Missouri law, prosecutors could press criminal charges against a woman or doctor who takes or prescribes contraception, though Governor Mike Parson has suggested the Department of Health and Senior Services will clarify that's not the case.
I think he's suggesting that by regulation they'll be able to change the criminal code, which isn't really how criminal statutes work.
That's why Meredith signed on to a letter calling for a special session to clarify what a medical emergency means so doctors know when to intervene.
They treat a harm to a two-celled fertilized egg as equivalent or frankly more important as taking priority over the health of the mother. And so for a doctor, they're told they're supposed to treat both of these as equal or frankly treat the fetus as more important than the mother's life.
Missouri's abortion law gives Attorney General Eric Schmitt special power to prosecute. He could put Missouri doctors at ease and clarify the line on which procedures and circumstances would warrant prosecutions or which ones would be legal under this new law. So far, Schmitt has not responded to questions seeking his input while he campaigns for the U.S. Senate.